I'm Farha Abbasi. I'm a MD. I'm a psychiatrist from Michigan State University. I'm part of the clinical faculty there. And I have this initiative which I call Muslim Mental Health. We have a journal which publishes the latest research, and then I have a conference that deals with the latest issues, problems related to that community and how we can approach it. To me, this conference has been a very great learning tool, but I did feel that the mental health was not given the needed prominence. So all the presentations talks about behavior, human behavior, how it needs to be changed, but we are not talking enough about behavioral health. I think mental health has entered a very interesting realm of preventive. Like any other medical field, we are also talking about how we can prevent somebody having a breakdown or having a crisis. How can we intervene ahead? So to me, there is no health without mental health, and state of your mind is state of your body. Unless you are a healthy, resilient human being, how can you take care of your environment? How can you take care of animals or be aware of what's happening to the plants around you? So I think everything starts with good mental health. Keeping that idea in mind, I started working in Michigan, which is the greatest Muslim population area, and I realized how stressed the community was. So I started applying all my experience in creating a program for them where we can develop resilient human beings or resilient, responsible citizens. I think immigration is a big trauma, a big risk factor for mental health. So keeping that in mind, and then all the new stress that the community is facing, I created this model. But as I started working on this model, I realized it can be applied to any community, any minority. So the model is very simple. It brings all the players together. And keeping the hierarchical status of most of these societies, where the family elders play an important role, religious leaders play an important role, and then the academics, how do we interact with each other and come together and create a model where we can support each other through this crisis. And I've seen great impact, and that's why I brought the project here, because I truly believe that this can be an initiative, a global initiative, because it requires minimum resources. It's using the resources that are already there, just bringing everybody together on the table. I can give you a small example. Her Royal Highness Princess Chulabon talked about how there is lung cancer on a rise in Thailand, and how incense burning in the temples is one of the risk factors. So imagine if you could bring the religious leader on the table and talk to people like that it is okay if you don't burn incense, that it can cause harm to your health. Same way I'm training imams, the Muslim chaplains, creating an awareness in mental health. So they know how to not diagnose, but at least identify the risk and to refer when the community approaches them. So I think this is a great initiative, but again, I would end on the note that there is no health without mental health. Thank you.